We're here today with the Affordable Meds Now campaign to speak to Congresswoman Eshoo about increasing access to affordable generic biologics. Biologics are any drug made in a living cell. They include vaccines, cancer treatments, and arthritis treatments. And many people in the United States take these drugs and they bankrupt families. They're bankrupting Medicare. They're a huge cost and they're driving up the cost of our health insurance. We're going to go talk to Eshoo about ensuring access to drugs for our patients. Go. The Stanford long way.
Here are some of the drugs we're here to talk about today. Herceptin, which is indicated for breast cancer, costs an average about $37,000 per patient per year. For those patients for whom their breast cancer is responsive to this drug, for the first time we have what appears to be a virtual cure for breast cancer for those breast cancers responsive to this therapy. Avastin is another cancer drug which is used for a wide range of cancers, from colorectal cancer to lung cancer, and it's been critical with diseases that were previously considered 100% fatal. Humira is for rheumatoid arthritis. It's an anti-inflammatory drug, also for Crohn's. And you know, there's immense potential, and it's something we should, as all Americans, be so proud of how innovation and science has generated these new discoveries. But at $100,000 per patient per year, we have to ask ourselves how many of these patients are actually able to benefit from these drugs.
The Access for Meds Now campaign. We contacted you about talking. Apparently we're not allowed to film inside of Representative Eshoo's office. They're going to send someone out to talk to us. So here we're here with a group of students from the University of California, San Francisco, Stanford, local constituents, and patients to talk about Eshoo's support of the current biologics legislation and current health reform. Would it be possible to have a conversation about that today? So we're just really concerned as medical students and future health professionals and patients and constituents about the effect such a long data exclusivity period with the evergreening provisions, which allow companies to basically tweak small aspects of their drug and restart their data exclusivity protection period, basically keeping generic biologics out of the market for extended periods of time. I mean, as Eshoo well knows, that's one of the best ways to bring prices down for patients and to give them access to a lot of these incredibly important life-saving drugs. We just feel that 12 years is far too much time to be giving these companies to be, raising enormous profits sort of on the backs of patients and our health system. So our question is, why are we giving them twice the data protection that we are giving small molecule drugs, which already make the pharmaceutical industry one of the most lucrative industries within the Fortune 500? Secondly, a lot of groups have come out with concern that extended data protection periods really decrease innovation within this space, which is the opposite, I know, of what a lot of investors argue. They think that the more money you can put into a space, the more money you're going to get out, the more attractive it's going to be investors, and the more research that's going to be done. But the Federal Trade Commission and many other groups have found that protecting the data in that way, by keeping generics out of the space and by keeping companies more interested in protecting the drug that they've already developed, rather than looking for new and innovative ways to solve medical problems, really decreases innovation.
And the government is already paying money for this research to be done that is eventually going to be used by the pharmaceutical companies. So, in that sense, thinking about the investment the government's already put in, the fact that eventually the healthcare system will be paying so much money on top of what they would already spend in the very beginning is just, I don't know, it doesn't make a lot of sense.
The biggest single industry group contributing is the big pharma political action committees. They contribute 20% of the $420,000. That's $84,000. The next largest group contributing is the Healthcare Professionals PAC, and that's $42,000, 10% of what she's raised. Big Pharma is by far her greatest campaign contributor.
My name is Jim Bliss, and 6 years ago I was diagnosed with multiple myeloma, which is a blood cancer, and I forgotten my insurance that year, and so when I went to get my first prescription, it was $1,000 for the first couple of weeks, and I found out that I could get the same drug for pennies on the dollar if I went to Mexico. So I went to Mexico and picked up a 3-month supply for $75.
We were handed a document with Anna Eshoo's general talking points on biologics.